Health care plan, Congresswoman Cynthia Lummis of Wyoming. Congresswoman, thank you for coming. Before we get to the Republican plan, what's the one thing, you know how sound bites work and bumper stickers, you can only usually focus on one thing at a time. What's the one worst idea that the Democrats have with their plan?
Putting a bureaucrat between a patient and a doctor is the worst part of the Democrats' plan.
All right, so how do you avoid that with the Republican plan?
Well, the Republican plan allows people who like their health insurance to keep it, and it provides tax credits to people who want to find new plans in association with their churches, trade associations, fraternal organizations across state lines to find bigger pools. It also allows for the portability of insurance, meaning you don't have to work in the same job for the same employer when you'd like to change jobs simply because you can't take your insurance with you.
Okay, let me stop you. Let me stop you right there if I can. Forgive me, Congresswoman, but the president and all the Democrats say that if you like your current health plan, you can keep it under their plan. Are they lying?
They're incorrect in this respect. If there is a public plan and it is going to tax non-public plans in order to pay for a public plan, it will move up to 119 million Americans off their private plans and onto a public plan.
But so the bottom line is you're penalizing people if they stay in the plan that they're in, and you're saying that you're going to see a massive influx of people into the government plan.
That is correct, and you will probably see rationing. You'll see more bureaucracy between yourself and your doctor, and you won't have the same kind of choices that you do now. Republicans want to keep the plans affordable and also give you a choice. And the worst thing we could do at a time when our economic recovery has not yet occurred is to take the engines of the recovery, which is small business, and tax them more. I want health care reform. It's very important to me that we craft a bipartisan alternative. But to do it with taxes on the backs of the small businesses we need to be the engines of recovery in this economy is not the way to go.
All right, Congresswoman, the president has really changed the whole dictionary, if you will, of health care in terms of the terminology he's using, starting with the first issue, which he says health care is the right of American citizens. Do the Republicans believe that?
Health care is a very important component of our lives. We want it to be affordable, portable, accessible, and we want to understand it. The system we have now is not as portable as it should be, not as accessible, it's expensive, and I hear from small business people, especially sole proprietors from Wyoming, all the time about the need for health insurance reform and health care reform. But the Democratic proposal is not the answer because it puts so many bureaucrats between you and your physician, and it makes your choices more limited rather than more expanded.
But does the Republican policy start with the same premise that the Democratic Party does, which is that health care is a right of all U.S. citizens?
Health care is a very important component of our lives. To say that it should be mandated by government because government says not only you have a right, but you have an obligation to have health care is not the approach of the Republicans. The Republicans would say you have a right to health care, and it should be affordable, accessible, it should be up to you. It should be your choice, not mandated by government.
All right, Cynthia Lummis, who is a congresswoman from Wyoming, and we should mention a rancher, which I think you should be more proud of than being a lawyer. It's a fine tradition. Thank you very much for being here. Appreciate it.
My pleasure. Thank you.
Whoa. Meanwhile, look at the Dow. I'd kind of taken my eye off it for a second. 224 points to the plus side. The Dow is charging ahead. What is causing this bull run? We're talking to a rancher. We got a bull run in our hands now. We're going to get to the heart of the matter at the NYSE coming next.